So I'll go ahead and start recording.
Got it. Okay. Alrighty. So hi, Andrew. Hi, Sky. You know who I am. I'm Grace Leal. I'm the coordinator for pre-professional advising, and love to have my colleague here also introduce himself.
Hi, everyone. I'm Josh Deason, pre-professional advisor, working with Grace, and yeah, just love helping students on their journey, getting ready for pre-professional school. So happy to be here today.
And so now this is the season that we're talking about preparing for the interview process. So yes, in the fall time between September, December, this is the season for interviews. So we'd really like to give students the opportunity now to just kind of understand the basic concepts and the overviews when it comes to the MMI format. So we're specifically talking about programs that utilize this format. UNR is one of those schools that does utilize the multiple mini interview process. So we'll go over this and also at the end give you a list of schools that are actually participating and doing the MMIs as well. All right, so let's just start from ground up, you guys, and we'll talk about what the MMI is all about. So for those of you who aren't familiar, it's a series of short interview stations used to assess non-cognitive attributes. So some of the topics they'll be including would be cultural sensitivity. They want to gauge your maturity. They want to gauge your teamwork abilities, empathy, communication skills. So everything that relates to the AAMC's core competencies are the areas now that they want to be able to qualify you on. So now the typical topics that come with these MMI stations, there's always going to be one that addresses a pathway station, which is your why to medicine. So obviously, one of those questions will be asking you, why do you want to go to our school and our program? Specifically, again, your motivation to it, so that you can already anticipate having a question around that. Now, for MMIs, there's typically about 2 acting stations where they want to see how you address scenarios, and you'll be dealing with an actor and an observer, typically in that room. And it goes through from healthcare or just ordinary scenarios in general. Now, there's usually one collaboration station, and the collaboration station really tests out your teamwork, your listening, communication skill sets. And this has been really important nowadays, and they've been leaning towards seeing how people actually operate, utilizing a team model. And majority of the other questions that you'll come across in your MMI stations will be discussion stations, where there will be a prompt and you need to talk through in the most systemic and most judicious way about current events, healthcare topics. It could also be social policies, the ethical issues, or strategies. And so sometimes there will be some random issues or scenarios that just happen in people's lives. But those are the 4 main areas that they'll be discussing. And for our School of Medicine this year, they'll be looking at 6 to 7 questions. And if it is in person, it'll be 10 stations. Okay. Now, this approach really tries to evaluate the non-cognitive skills, as I said. And here are the key areas that medical evaluators are going to be judging you. So first of all, again, that motivation for medical career. So the pathway station, hitting that really hard and being genuine and being very sincere in your answer. 96% of admissions evaluators want to see also the compassion and the empathy skills that you'll be, your tone, your body language, how well you're also communicating that in those scenarios. And the maturity, how well you know really what the challenges are in the healthcare, and are you able to address them intellectually, emotionally, with a sense of deep responsibility. And obviously oral communication skill set. So we tell students who are typically shy or quiet. Now the MMIs definitely will put you on the spot. So you have to be able to think very clearly and respond almost at a notice. So for some students, for those who are really introverted, it could be a little bit more challenging for them. Critical thinking skill sets, obviously, the way that you problem solve. They want to see leadership skills, and these will come out in some of these prompts. And a big area too is understanding ethical decision-making scenarios. And we'll walk through some of that this afternoon. Okay, so other things to consider. Now, because majority of the interview process in this cycle are going to be online, you still want to dress professionally. And I do tell students, it's not just dressing up, waist up. I did have one of the evaluators say, I might even ask the gentlemen to stand up because I want to be able to see them wearing a full suit. But, obviously you want to dress the part. And when you start your interviews, introduce yourself, whether it is going to be through online or in person. Always give a very positive energy and tone about yourself. Now, if it is in person, I typically extend my hand, and I hope that students will also do that as well. And always give your name to the interviewer. And watch your body language, smile, eye contact and handshake. And at the very end, always thank the interviewer for their time for listening and reviewing you as you go through your questions. Okay, so these are examples of MMI questions that you might come up with. So just scenario one, this is a typical discussion question where you'll have about 6 minutes to talk about your answer. And so here's the question. You're a respected primary care physician with a growing list of patients. You see approximately 17 to 20 patients a day. Management expects you to see twice as many patients a day with the goal to eliminate your position and hire on PAs to do your job. This prompt asks you to discuss what you would do in this situation. Okay, so you typically will have 1 minute to look at this, think about it, hold your thoughts in your mind, and then when you enter the room, then you'll be able to address this question as best as you can. Now, scenario two, like I said, this is the pathway. Why do you want to attend UNRSOM? And a lot of students have this already written out or memorized, but again, you don't want to sound scripted. You want to sound very genuine and authentic. And typically they'll also ask you, what do you believe are the healthcare priorities for the state of Nevada? Regardless of programs, it's going to be a mission matched question. So you need to be able to address specific things about those schools in that scenario. Scenario three is the role playing. This is where you ask to be involved with an actor, and then there will be an observer in the room. And in this prompt, you are an ER waiting room assistant. There is a gentleman who has been complaining of a long wait to be seen. In fact, he states it has been over 3 hours. He can understand why others who came after him are able to be seen sooner. He becomes disgruntled and upset. And in this prompt, you're asked to handle the situation. So it is acting. You're going to have somebody acting out their impatientness. So obviously you need to be able to get in there like real life and talk to this person. And the observer is going to evaluate, how best you can handle, the person. Okay. So these are typically the 3 areas. Do you all have any questions about these or ideas on how you would address them?
Yeah, I mean, so for example, the first one, I was just kind of I had a question if that scenario was referring to, are they actually trying to get rid of the patient contact with like the physician, and in this situation could I actually like ask them to clarify before I go on about it, or if they're just talking about how they want to hire PAs to be able to see more patients than what I am seeing.
Right. And so in some of these discussion questions, there won't necessarily be room to ask clarifying questions, although if it is in person, there may be additional prompt questions that you can ask midstream as you attempt to discuss this. Really, what's most important in these kind of prompts is to talk about the pros and cons. So in regards to this question, what's happening now in hospitals, if you look at, demands, a lot of physicians are feeling burnt out because there is a growing expectation for them to work with a higher volume of patients. And management has forced a lot of PAs to take over physicians who don't want to abide by these new business practices. And it is a real scenario here in the state of Nevada. So in this scenario, how would you address that then?
Well, first I would probably maybe start it out by saying that, that physicians are feeling more burnt out, and that, the more integrated role of PAs might be a better approach at taking physicians who are forced to see too many patients, where that patient interaction is compromised. And if we can have more help so that we can see a lesser amount of patients, or the amount of patients that we're seeing already, and keep that quality high without compromising that to see more patients, I think that's a good thing. And like it kind of goes back to leadership roles. When you have too much on your plate, then your quality of your work is compromised. So I don't really see that as in a threat to my job, as long as I'm still being able to interact with patients and perform the job that I'm trained to do. I think it's okay, especially if it helps out with the quality of our care.
Okay, and so you definitely throw out those pros and cons.
Mm-hmm.
You want to be able to talk about what that does to the physicians in terms of quality and time and accessibility to patients. And then the PA side, how does that supplement? So really come with evidences to support those both. And the more that you're able to do that, that's what the evaluators want to be able to see.
Okay, cool.
Anything else about pathways or role playings? Any questions around those?
I guess just the acting thing kind of took me by surprise. I didn't realize that you'd actually like be acting out a situation instead of like just saying how you would handle it, but actually like handling it. So that's kind of an interesting thing to prepare for too.
This was actually one of the stations I was assigned to as an observer. And we had to ensure, and these actors are actually coached. And so some will really escalate it. And in some cases, they are told to really be rude and impatient. So you have to be able to de-escalate that situation.
Yeah. I was kind of thinking like a good way to approach that would just be to, obviously stay calm and show a lot of empathy, no matter how like upset they get. But like, what do you think would be a good way of doing that?
Absolutely. That's what you want to see. And if you have to repeat yourself over and over and over again, it's just being consistent and not losing your own temper. That's the main thing. This is really addressing your emotional IQ.
Yeah, no, that's cool.
Okay. So I hope these kind of help you out to understand. So the other aspect of the MMIs is really managing your time. The more you can practice this and rehearse, even if it's through the mocks, this will also help you to gauge in your mindset how much time you have left. And you obviously don't want to give short answers where you're also sitting there for the next 3 minutes in dead silence. So utilize your time very well. When you enter the room, You definitely want to be able to just utilize maybe a brief moment to summarize the question or the issue, and then go ahead and convey the focus or the theme. And then you got 3 to 4 minutes to discuss that. I would always use 3 to 4 minutes initially, and then ask the interviewer if there are additional questions. That way, you know if you're staying on course or you're definitely off track. And some of the students, that's when they reset themselves and they realize, oh, I've been addressing this all completely wrong. So you do want to check in midway. Usually some students are right on point and the interviewer is saying, no, go ahead, keep continuing. And then you want to use the last minute. You'll hear a bell to let you know that there's only 1 more minute left. And then you want to summarize everything that you've said. Okay, but this is really important. You don't want to be also too short, but you also don't want to be able to ramble where you're utilizing the whole time and not checking in. Now, this is our suggestions. So when you're thinking about how to manage that time and you're reading like the first prompt question about the, how much your caseload is 17 to 20 patients a day, and they want you to double that. So really what you want to do and hold in your mind is about 3 to 5 important points about that topic. All right, so suspend that in your mind. And then you want to discuss those pros and cons to it. State your point of view and the reasons why you feel this way, but it needs to be not just opinions. It has to be based on evidence. What have you observed before? What are the facts? What are the researches around that? So you need to be able to provide support for your views and show that you've also considered other points of views. Evaluators want to see that you're able to keep a broad perspective on all the issues and not be biased as well. So think of past scenarios, think about what's going on in the present, and if you know future implications, talk about those as well. I like to use the who, what, when, where, why, and how format. So when you're going through this, who's involved? What does this entail? When has this happened? Where is this applicable? Why, the reasons around it, and how, okay? Because that's going to help you to build substance in your answers. And talk about this if it affects you personally or how it affects the world in general. Sometimes you'll have questions about cancer or grievous, diseases, and you might be able to say, yes, I've gone through this. My grandmother had experienced it. And so also when I shadowed, I've seen other patients going through this scenario, and then that's how you speak to it. All right. So an end with a very strong conclusion as well. Now let's talk about this one, okay? This is scenario number 1 with this healthcare, and it's knowing about diseases. And so Alzheimer's disease is an incurable disease of the brain that destroys memory and thinking skills. In its early stage, patients have no symptoms. In its next stage, there are mild symptoms, which are often simply attributed to the aging process. Recently, researchers reported promising preliminary results of a blood test developed to detect patients with Alzheimer's disease at a very early point. Discuss your thoughts on this matter. All right. So you have to apply these basic steps, right? So lead into a personal story. So if it is like your grandfather, your grandmother, your aunt, your uncle, acknowledge that. Acknowledge your source of knowledge around this. And then again, you want to suspend at least 3 to 5 points in your mind, right? So important points to consider. Early blood tests would allow early detection. What are the implications for important decisions about the patient's future, given the timing of this? Then you want to talk about end-of-life arrangements, maybe. What if they're further along? And then the financial implications to this, right? Then you want to talk about those pros and cons. How would they prioritize their life plans? Again, discussing this. Commitments like families or trips. You want to address the emotional aspect of this. Students could be very stressed, depressed, or even anxious. And if that's the case, you want to understand and talk about mental health resources, counseling, referring them to other specialists as well. So it's not just your areas, but you got to talk about, again, who, how, the implications to the patients. And then talk about your points of view, addressing things that you've seen in the clinical settings or shadowings. Think of past, the present, and the future. What's going on now in terms of Alzheimer's disease? That's why when you're shadowing, you have to find out, okay, what are the prognosis now for the future? How do you talk to your patients about this? Again, the who, what, where, why, how, and why. And then how does Alzheimer's affects people in general? So you got to always remember, as a physician, when you're talking about diseases, you're educating your patients. And here we want to see how much knowledge you've gained so that you can be able to educate other people too. All right. And then your conclusion. Any questions around this one? Any questions? That's why it's so important to read everything that you can about diseases, scenarios, patients, knowing the pros and cons. Okay. Now let's talk about that acting station now. So here we go. We just talked about that. So let's just actually see if we can actually give a stab at this one. Josh, do you want to actually handle and try to do this? Like acting it out?
Sure, like act like I'm the patient
The patient.
on the spot.
Does anybody want to try to be the doctor?
Yeah, I can try, unless Sky wants to.
Oh, you got it.
It's about practice, you guys.
I don't know if this is going to be good, but I can try.
Okay, let's try this.
I'm new on this end too, so we'll see what happens.
All right.
Okay, so I've been here for over 3 hours. I came in not feeling well. There's like 5 people that came in after me. What is the deal? Why am I not seeing anybody? Why am I still sitting here after all these other people have already been treated?
Yeah, first off, I want you to know that I understand where you're coming from. And, you know, I've been in waiting rooms for a long time, and it's not the most calming thing. It can be pretty frustrating. But I want you to know that our doctors and nurses back there are doing the best they can, and they're treating people in the order of importance, and they're getting to you as soon as they can.
Yeah, but I mean, why am I not important? I've been here so long. Obviously, I'm not feeling well. I came to the ER. Like, why am I here? Are you saying I'm not important?
No, I'm not saying that at all. What I'm saying is there are some patients that the doctors and nurses have to look at objectively and understand who needs care the most. I mean, they could be life-threatening stuff going on, and it's their decision as to who they're treating. So, have you been evaluated yet by anyone?
I haven't seen anybody. The nurse asked me a couple questions when I checked in, and that's all. Nobody else has even talked to me.
How about I go talk to a nurse and see if she can come and just do a quick checkup on you and make sure that nothing serious is going on, and maybe we can get some more, just give you some reassurance that they're getting to you.
Well, I think I'd really appreciate it. That'd make me feel a lot better.
Yeah, thank you, sir. Just be patient with us.
Okay. Yeah. How did that feel, Josh?
Yeah, I mean, I felt like at the end, if you really could get a nurse to come talk to me, you know, I think I would definitely feel a lot better, and at least someone was paying attention to what my concerns were.
Right.
Yeah, I think I kind of might have messed up when I talked about the order of importance. I feel like as soon as I said that, I shouldn't have said that. So I don't know.
Right. So when you're in this scenario too, again, you know, this is why your shadowing and clinical observations are so important. Understanding what the triage process looks like. so you can be able to communicate how they do triaging. And so that's on one hand, which is, the hospital rules. And you want to explain that, but at the same time, how do you show compassion and empathy? How do you show listening skills and attention to the person in the waiting room and address the anxieties, right? So you still have to talk about that. And my other suggestion would be, you did talk about the nurse, but you might want to say, is there anything that I can offer you? Water, drink, a magazine. I definitely will check in with the attendant and see where you're at on that list. But in the meanwhile, can I get you anything to drink? Can I get you something? You want to show those kind of those things too. Okay, Andrew.
Yeah, that makes sense. When I'm working at Renown, this kind of stuff kind of happens every once in a while because I actually do work in the front office as one of the ER like admins, and that's something we say all the time. So I don't know how I just like overlooked that. Maybe just like getting put on the spot was hard to, like I do that all the time. I don't know how I missed that.
Exactly. So these are the basic steps and it's there. But I think when you get into a crunch situation, you tend to kind of revert. And that's why staying calm, thinking things through and being clear is going to be so important as you do this. The more practice, the better that you get. So again, listen to the patient's complaint with compassion and empathy. And you want to be able to read what they're saying so that you understand how they're feeling, okay? What is at the heart of it? Are they feeling like they're not overlooked? And as Joshua says, I don't understand. There's 5 people ahead of me. They've gone. So he feels overlooked. And you want to be able to address those feelings. Has he not been attended to? And he says, nobody has seen me. Nobody has seen me. So again, it's a call for like, can somebody make sure that I'm still here, that I'm important, right? And what really is the issue? So again, the assessment part, like you said, and then what can you do to help them? And that's the other thing too. What can I do, sir, for you? What do you want me to do? Right? You need to ask that. So try to best address what the patient's requests, what they want. Again, talk about the policy issues, what's the procedure on the ER floor, and assure the patient that they will be seen, check where the patient is at on that waiting queue, and ask patients if you can get water or snack if hungry, and really try to stay calm. Like I said, these actors are actually prompt to be very emotional. And Josh was being nice, I thought, because in certain areas they are screaming at you. And it really takes you off guard where you're thinking, okay, how do I stay calm? How do I follow what I know? Okay. All right. Now, collaboration stations, these are task-based stations to test your ability to stay composed under pressure again, while working as a part of a team to complete a complex task. So it could be like putting together a puzzle, could be a structure, a building structure, could be identifying a missing piece in a picture. But you got to stay focused, use your listening skills. This is where you have to clarify directives, ask a lot of questions, don't automatically react, and don't assume. Now, sometimes what they do is on a visual kind of thing, like you have a visual task, don't assume that your picture looks the same as the other person on the other end as well too. We've actually flipped things upside down or sideways or on an angle. And so you really have to be able to address if somebody says, oh, it's the blue circle, you go left and then you turn up right and draw these lines. You have to actually utilize every single attempt to communicate the best that you can. So it's identical in some of these test areas, okay? Sometimes they even tell you to draw the same pictures as the other person on the other end. And then at the end, you have to hold it up to see if you're matching one another. So that's what they do for the collaboration stations. No way to rehearse that one. Now, the most difficult, I think, of all the MMIs are the ethical decision dilemmas. And I invite you guys here, take a screenshot, because really these are the topics we usually hit. So they want to know the doctor-patient relationships, about confidentiality, informed consent. What are the patient's rights in certain situations? End of life scenarios, professional misconduct. We talk about that all the time. Medical negligence, relationship with pharmaceutical industries, research ethics as well too. Physician-assisted suicides, physician impairment like alcohol, drugs. It could be your peers, could be your supervisor. How do you address that with them? Practicing procedures on anesthetized or dead patients, transplants or organ donations, issues related to reproductive health, issues related to treatment of mentally ill patients, performing procedures and tests that are not medically indicated for reasons of defensive medicine. COVID-19 will be big ones. Conflict of interest, healthcare rationing, issues related to vaccination is going to be huge, and issues with underage patients. Diversity is a bigger thing too. The other things that we talk about are like accessibilities to patients in rural medicine. So that could also be another scenarios. So these are the most common, okay? And when you're utilizing the ethical decision-making process, understand bioethical principles, understanding what are the facts behind this. And you want to be able to define those ethical issues, autonomy, who are the stakeholders in this, beneficence, what are the consequences of the costs or risk that are involved, non-malfeasance, identify obligations, because as a physicians, you are obligated to do no harm or add on to more harm, right? Justice, you have to know what's right or wrong when it comes to these decision-making things. And then other things that you have to consider. What are the basic laws that governs a region, a state, or a population? Also your gut feelings, basing things from past experiences, but also understanding what the biases are out there, and also for your own self. When it's also talking about process, you need to be able to talk about who are the experts in the field, who are your supervisors, and also the family members that are involved in this patient's situation. Then you want to talk about possible actions, what are the solutions to this, and deciding on a course of action. And here again, this is six things, right? And if you only have 6 minutes, this is basically a minute a piece to go through this very fast. And so as much as you can sustain in your mind about that scenario is what you want to be able to address in that amount of time. And if you can get through it, then you'll be fine. But this is where you need to practice, and understand healthcare issues around ethical decision-making prompts, okay? So let's go through this one. You are treating a patient with breast cancer. A lump was surgically removed, but she does not want to undergo chemotherapy and radiation therapy as follow-up, and instead wants to try complementary and alternative medicine, CAM. How should you address the issue with her? Anyone want to take a stab real quick?
I can try this one.
Okay, go ahead, Sky.
So I would obviously not argue with the patient, but I would give her the information, like the facts for both routes. So I would give her the facts about the success rate and the problems with chemotherapy and radiation. And then I would give her the pros and cons of alternative medicine. And then I would give her the facts and I would tell her what I think that she should do, but ultimately it's her decision and she's the one that's going to be making it. So that's kind of like how I would address that situation.
Okay, Andrew, what do you think?
I think what Sky said is awesome. Another thing I would probably say is, complementary medicine by definition is the use of both alternative medicine and, regular, like, I guess allopathic approaches, I guess you could call it. So, complementary doesn't mean you're just abandoning one side and going all the way to the other. And so if you really want to do complementary medicine, you could incorporate alternative and some other things too.
Okay, good, good. So let's walk through this. So obviously gather your facts, right? Assuming that risks exist in refusing treatment, why does not she want to pursue it? So again, asking the patient, talking that out, right? Does she understand the risk of not pursuing the treatment? And does she have a cognitive capacity to make this decision? So does this also person have Alzheimer's or depression? So again, every scenario is going to be very different with a patient, right? So these are things that you also have to keep in mind when you're explaining your question. Number two, here's the bioethical principles. So let's go and walk through all of this. So autonomy, she does have the autonomy, which Sky had mentioned. It is going to be her choice. But then again, is she under duress, or is somebody else maybe making this decision for her? So this is something that you still have to probe, right? The other thing too is, how acute is this? So does she have any other symptoms? And was the lump surgically removed without problem, or did it spread already? So you still have to address the depth and the degree of the cancer, right? Stages. That's the other thing too. If it's stage 1, what are the steps for that? But if she's already step 4 or stage 4, what are the risks involved? So then the degree of risk now to do no harm, right? We want to do no harm. Again, that's part of the ethical decision kind of thing. So you have to be able to talk them through this. And then how is she coping? What does she need? Maybe she lives with her husband and other children and caregiver. So these are the things that you want to also bring up and mention. Is she alone? Is she under the influence of some other person there? Or who does she know about, like, alternative method that was actually successful? And there's the physician. You have the responsibility to help her through this process. So again, so succinctly in 1 minute, talking about these things. And then let's go through beneficence, right? Radiation, chemotherapy might help her. Talk about the benefits, talk about the risk. CAM, it might not be proven to work, but if it's going to help her and give her some comfort, maybe she still has some control. Maybe it is a decision about that. And alternative herbs, maybe she did hear about some certain things, so she can still maybe utilize some of that. Again, you're in that position to do no harm. So what would happen if she does not pursue radiation or chemotherapy based on the stage where she's at in her cancer treatment right now, right? And what are the odds that her cancer will return? You have to be able to talk about that. Now, what's right or wrong? Is it because she doesn't have insurance, or the decision made by her family already? Okay. And then other consideration, are there laws? Are there religious kind of reasons around it? Again, be aware of your own gut feeling. If you've met with this person before, you have a long history, what's going on? What are the biases now? Maybe she's got some biases around that. Or maybe you have some biases about alternative medicine. What's important to know here, all right? And really fleshing out, again, what are the biases around both areas? And the process. So are there family members that you have to speak to about this? Are there spouses, offspring, siblings? Again, if this person has already have Alzheimer's, are they in that position to make that judgment? And then what are the experts saying as well too? Is she seeing other specialists and supervisors? Maybe if this person is working, what's going on? You need to be able to be thorough. All right, and talking about everything that's going on. And then here's the possible solutions. Again, pros and cons about that one, alternative solutions, options, what are the options? Can you mediate a solution that she'd still be very happy about? What are the family's points of view around it? And also, if she's got a lot of apprehension, feeling anxious and fearful, Would you refer her to counseling to also get some ideas to maybe to talk about how to cope with this process? Okay, so those are the things. And in just less than 6 minutes, you got to go through all this. Okay, and then weigh out competing principles. Again, prime short term, what are the short term, long term consequences, the magnitudes of those consequences, and then again, what are the arguments that are most compelling? There's so much just for the ethical decision. If you can get halfway through this, then you'll be in good spot. Okay. All right. So again, know this principle. Again, take a picture of it, understand all of this, because when you're starting to review those topics, you want to already start to write these things out. And that way you're better prepared for it when it does come up. Okay. Let's do some practice. So in the time remaining, let's go through a couple of questions here. And here's a practice scenario. It's a discussion question. And it's about physician impairment. So you are an emergency physician who recently experienced the loss of your child and is currently attending your son or your daughter's funeral. You are suddenly called to come to the hospital because there will be a child who is in critical condition from a car accident en route via ambulance that requires your immediate attention. You are the only emergency physician within a 100-mile radius. What do you do in this scenario? Any thoughts?
Well, I think that's definitely a hard one. Man, I think oh man, I mean, if I was at my son or daughter's funeral, I think you would probably be in a, in a mental state that might not be the best for the patient. But then again, there's also, there's no physicians within a 100-mile radius. Then, is your presence when you're not, maybe in the best mindset, gonna help or hurt that patient? And I think that's kind of like maybe like a risk benefit analysis on, how mentally competent are you to benefit your patient? Like if this physician was, at the bar or something and drinking, he'd probably have to say no. And you could probably argue that your mental state is similar to that. If you're thinking about, you'd probably be upset and emotional and thinking about, you have to leave your kid's funeral to go do this. And so like, I think you could probably say that your mental state isn't where it needs to be, but that's hard.
All right. Yeah, this is a difficult one. Sky, what do you think?
I agree everything with like what Andrew said, just about your mental state is probably not where it should be. And especially if you're working on a child, then you might make a mistake that you typically wouldn't because you're not 100% like focused. However, if you're really like the only option, like one way maybe to look at it as if like, if this was my child and I had the opportunity to save them, like, can I like put aside for like the next hour, however long it takes, to just like focus on this as if I was saving my child? Then maybe you can like convince yourself. And then the other thing I would do is just be honest with everybody I'm working with so that they know that, hey, I might not be in the best state of mind. So like, I need you to watch every step that I'm doing. Tell me if I'm not doing something that's typically along the books, because typically the people that you're working with in surgery, you are working with like constantly. So they pick up on certain tools and surgery techniques that you might typically do. So I feel like if I had to come in, then I would definitely be honest with the people I'm working with about the situation.
Right, right. And this is a hard one. And obviously, as a physician, your Hippocratic oath is the oath that you took, and you're there to serve, right? And this is a discussion to be had even when you get into a committed relationship. They need to understand that your profession is going to be your priority for the rest of your life, especially if you are in rural medicine. Where does that stand? So they have to understand these may come up, and it might not necessarily be the own loss of your child, but it could be during holidays, times of family gatherings. It could be, you know, your favorite Thanksgiving with your own parents or whatnot that you've never seen for like years, and you get called and you got to just go. And so here is why you have to have that communication with your partner. And then in this scenario too, being able to address, okay, here's my Hippocratic oath, but then there's going to be some mental things that I'm dealing with. You also have to also consider, okay, if I can save this child's life, maybe I can save another parent from mourning or going through the sufferings that I've had to go through. And that's the other consideration. So really looking at the other side, who is also involved, right? Who are the stakeholders? And then you're right, it's like talking to your team and alerting them and letting them know of your own mental state, because that does show accountability. And again, team communication, that is so important. And again, it's a 100-mile radius. When you take on that job, you know you're going to be called in at any time of the day or night and scenario, situation, right? Okay. All right. Now let's try to take a stab at this one. Okay. It's patient rights. College-age student is diagnosed to have bacterial meningitis. He refuses treatment and returns to his residence in the university housing complex. You are a resident doctor of this complex, or resident director of this complex. When he tells you about his condition, how do you respond to him? Who wants to take a stab at that one?
This may be a silly question, but is meningitis super contagious?
It's actually something they can't enroll in classes without getting the vaccine.
Okay.
I think I would first respond to him and say that, you know, he does have the right to deny treatment if that's what he wants to do. But he also, you know, you could explain to him that if he's denying treatment, he can give up his right to be in that complex, especially if it's going to put, you know, hundreds of kids in harm's way. So I think I would respond to him by first like empathizing with his decision and saying, like, you know, this is your decision, but you can't put all these, you know, kids in danger. And then maybe start to work out a process of, you know, attending school remotely or something like that through Zoom, maybe like with COVID or something like that. And then you know, and also encourage him to maybe rethink his decision and get treatment and see if he's like in the right mental state to understand the consequence of not getting treatment with meningitis.
Okay. Any other thoughts around that? Scott?
I think I would just like the fact that it's required for students to get it just shows how like dangerous it is if somebody gets it. So I think I would emphasize like the fact that there's a reason that we have to get the vaccine before we can attend school. And I would try to share as many facts about the rate of people that can die from this disease and how severe it really is. And that obviously it is his own choice, but I would just try to really be like honest and like push him, not necessarily like push him, but like explain the consequences if he chooses not to treat it compared to if he decides not to treat it, like the possibility of a success rate of him getting over it.
Okay. So here's also some of the back scenarios maybe. And you know, for this one, like I said, there could be additional prompts when you're doing some of these kind of things. But in this role-playing scenario, the student really didn't want to do this because he has no insurance. He has no insurance right now to be able to pay for it. And so when you ask, the most important thing here is to ask why he's refusing it. That's the question you want to be able to raise. So why don't you want to? And then hearing them out. Was there fear? What was happening around that? Is it jeopardizing something else? Is it jeopardizing his ability to be able to stay in the residence complex at the same time? So it could be double jeopardy for him. So you want to be able to throw that out and understand where that person is coming from. You want to alleviate the housing rules and in this situation, because you are the resident director, it is your responsibility to inform every single student of what the laws or what the protocols are. But maybe there's also something else that's going on there. Is it because of his classes? He doesn't want to miss things. Is he also underperforming in classes? So he really wants to get back into school. Has he talked to his faculty? Has he talked to his academic advisors about what's going on? Has he talked to his family? Does his family even know? Right? So who are all the stakeholders that's involved in this person? Is he underaged as well? You know, what's the age on this student? Again, you have to be able to address all of this. And then walk through the appropriate scenario based on age, based on economic situations, based on maybe academics. So you've got to go through extensively to find out what the student's profile is first. Right. And I think those are the pieces that you guys have to really keep in mind. All right. All right. Now, this is what we suggest. This is a great resource to use. This is the multiple interview book. It's strategies from admissions faculty. So page 17 and 18 has the list. There is actually a new list that keeps coming out now. More schools are actually doing MMI formats, but this is a great resource if you have a chance to just order it online through Amazon. I think you're going to find the prompt questions and how they answer it really helpful for you. Any questions at this point? You know, we wanted to give you a brief overview of what the MMIs are. I think you understand now how it is important to understand topics and how you're going to be able to address those.
And Grace, I can share real quick the most recent list we have, just so they can see kind of the list of schools at a glance. Who is on there currently.
Oh, nice.
So,
We got to put that on our resource board.
yeah, so you can see there's quite a few. And we have different disciplines here too.
Yeah, this is just hot off the press. We just got this information like today.
This is from our colleagues at the University of Cincinnati, and they collaborate with other pre-health advisors across the country to put together, you know, the most recent list that we all know of. So,
and it does also include the osteopathic medicine schools too, which is great. Okay. All right. Any takeaways from what we talked about today?
I had a quick question. So like, I understand this format was kind of addressing the, you know, the MMIs, but is there, you know, a similar approach to schools that don't use the MMI? You know, like just, I was doing some research on interviews, and some schools will just do like a traditional like panel, and they just kind of talk to you for an hour, right? And they like ask you certain questions. And so I'm sure like some of them would be in similar format to an MMI, but I guess what I'm asking is like, do you prepare for those different interviews in the same way that you would prepare for like the MMI?
The traditional ones typically will also be able to give you a prompt ahead of time, like UNLV, and it really is based on core competencies. And it is going to come out of the scenarios as well too, but a little bit more free flowing for them. You know, how do you handle conflict in the hospital? How do you also address team or, you know, impairment from a colleague when you see them? But really they want to be able to just genuinely be able to talk to you without those prompts. And which is great. I like the traditional style because it does help those who are a lot more introverted to process things without being right there on the spot and having to, in 6 minutes, addressing things. And there's some that are also doing hybrid models. So it will be like a panel, and there's going to be one-on-one. And then sometimes there's going to be sessions where you're working with med students themselves, and those students are going to be talking to you about your match. So in those kind of scenarios, these interviews could already just happen as you're walking through the hallways when a medical student is asking you, how do you like the school so far? You know, it is that informal, but at the same time, you're already at the spot. From the time that you introduce yourself to the receptionist, all the way to the very end, they're watching you.
Cool. That makes sense, and that's a lot of help. So thank you.
Okay. Yeah, not a problem. All right. We hope that this has been helpful for you. Sky, do you have any other questions, or are we good?
No, thank you so much for your guys' time.
You're very welcome. All righty. Thank you so much, everyone. It's good to see you.